Healthcare in the U.S. can be very costly. Americans spent more than $14,000 per capita on healthcare in 2024, according to HealthEquity. And the percentage of U.S. adults who were unable to afford or access quality healthcare reached 11%, which is about 29 million people, the highest level since 2021, according to the West Health Gallup Healthcare Indices study. Joining us now, we've got Scott Cutler, who is the CEO of HealthEquity. Scott, good to have you here back with us in studio. Tell us about health savings accounts and how they can help bridge that affordability gap.
So first, just understanding what they are. This is an account that is a triple tax advantaged account that you can contribute pre-tax, grow tax-free, and then can spend it tax-free on healthcare related expenditures. It's the fastest growing savings in the U.S. It's grown as a market from 10 to 135 billion in the last 10 years. But today, we have an affordability crisis for healthcare. 40% of Americans cannot afford today a $400 unexpected medical expense. And so you really need to be thinking about how is it that you can be prepared to handle that, plus what you're going to need ultimately in retirement.
And so what are some of the downsides to HSAs as they are structured right now? Because there's this need to expand access as well beyond high deductible plans.
So they are tied to a high deductible plan. So when you're in the open enrollment season, these are provided through your employer. The first thing is you should be selecting a high deductible health plan associated with an HSA. And one of the big barriers to it is the misconception that a high deductible health plan is more expensive than a low deductible plan. But when you look at premiums as well as deductibles and your out-of-pocket costs are typically about the same. But here, if you choose the right plan or if your employer is incenting the right behavior, you can have a vehicle that can save and grow over time that you can use for those medical costs that you need at any time.
I wonder, as you and your team are looking through what's working its way through Capitol Hill right now in this tax bill, what are the implications, especially on the healthcare sector and through the lens of HealthEquity right now?
This legislation today in its current form has the first expansion of HSA access and flexibility for the last 20 years. And so on the access side, it's improving access for individuals, for example, in retirement that have selected Medicare A and might have a high deductible health plan. They are now eligible to be able to contribute to an HSA. If you are under an ACA plan, bronze or catastrophic, you can now participate. Or if your employer had an on-site medical clinic, you could not participate as an HSA, have an HSA. On the flexibility side, the legislation proposal provides the flexibility to apply HSA funds for gym memberships or to telemedicine. And those provide greater flexibility in terms of where you can spend those dollars that have been put away so sacredly.
We were having our own discussion among our production team earlier this morning in our AM meeting just about the transferability and the rollover in HSAs as they stand right now. What do people need to know about that?
Again, breaking down the misconceptions in the industry, an FSA is a flexible spending account that is a, use it or lose it.
Right.
And so typically a year, if you don't spend it, it goes back to your employer and you lose it. An HSA is portable, it stays with you. So once you've contributed, you'd have it for your lifetime. You should be maxing out your HSA every single year. You might consider maxing out that HSA before a 401k because it has better tax advantages than a 401k, and it's setting you up to be prepared for those costs into the future. So we like to think of it as how can you save, invest, and then ultimately spend for your healthcare needs.
Even as we were talking in the break, I was trying to draw a through line through your various roles that you've held over the course of your career here. And the thing that came up in that Venn diagram, at least for me mentally, was marketplace. How is this marketplace and the health landscape right now vastly different than what you've seen before? And what is HealthEquity really trying to position itself to do to really revolutionize that marketplace?
This is the opportunity that got me excited about HealthEquity. Coming into a 25-year-old company, it's the leader in its space, and yet healthcare healthcare as an industry is very different than the standards that we expect out of a retail experience, which is to say seamless, easy, frictionless. You see price, you can make discovery. Imagine buying something where you didn't know the price. We would not accept that in most other experiences, yet that is the default position in healthcare. And so we believe that there's an opportunity to make healthcare easier, more seamless for our members, and through experiences that we can make available on a mobile phone, a mobile device, to have transparent, educated decisions about where you're spending your health dollars and be engaged in that as a process. That is what I see as the opportunity.
I think there have been a lot of calls for transparency, especially in the healthcare space. Scott, good to have you back on set with us. Thanks so much.
Thanks.